Osteoporosis and dental infections. Fosomax issues in endodontics and how our practice can help. Oral bisphosphonates are effective for reducing the risk of osteoporotic fractures and are important for the quality of life. But with all drugs, there can be side effects. The side effects must be weighed and balanced with the good of the drug. Osteonecrosis of the jaw can be a side effect of taking the drug like Fosomax, Canal, and other bone cancer drugs. Physicians work very diligent to balance and monitor their patients. Our practice assists the patient in screening for dental infections that could exacerbate a potential problem. We communicate with your physician to assist in your overall health. Some background information. Bisphosphonates, like Fosomax, reduce bone loss in diseases such as osteoporosis, multiple myeloma, Paget's disease, and bone cancer. Bone is always active. New bone cells are grown and old bone cells are removed. As we age, unfortunately, the balance of removing bone is favored over new bone being formed. For simplicity's sakes, let's say that Fosomax drugs stop the cells that remove bone. That doesn't sound bad. It actually sounds pretty good. But that makes us accumulate more dead bone cells, creating weakness in the bone. This can be more prone then to fracture. The bisphosphonates accumulate in bones that are more active and in constant movement. The leg bones and the jawbone. That is the relationship. How does it affect the jawbone? Osteonecrosis of the jaw develops when the jawbone fails to heal after a minor injury. For example, the type of injury sometimes caused by getting a tooth pulled, a dental implant, or having an existing root canal done poorly. How long does the drug stay in your system? Believe it or not, 11 years. The image below shows some dead bone that had to be removed from the jawbone. What to look for? Symptoms include pain, swelling, or infection of the gums or jaw. Gums that do not heal. Loose teeth. Numbness or heaviness in the jaw. Drainage of jaw abscesses. Exposed bone showing through missing gum tissue. The chart below shows that there's an increase in cases in the mandible, which is the lower jaw, not as many in the upper jaw, the maxillin, less frequent in both jaws at the same time. Sometimes there is no pain, and many times occurs after a tooth extraction. The below patient was referred to our practice having a poorly done root canal. Infection was left in the tooth. The infection caused osteonecrosis in the jaw. Seen on the 3D image, the dead bone was removed through the gum. The patient was referred to her physician for monitoring. So, how can we help? Instead of pulling a tooth, a root canal can be done properly. The tooth can be maintained. If the tooth needs to be pulled in the future, then your physician will be consulted for a comprehensive plan with your best interests in mind. As root canal specialists, we have all the means to maintain the highest sterility when doing the root canal. Laser, rubber dam, and microscope to find all the infection in a tooth. 3D imaging to see possible problems that a traditional dental x-ray may not. A screening is easy and can be informative. Any questions, always feel free to contact us at the office.